Welcome to another episode of Clinic Success Secrets, where we uncover the strategies and insights that drive clinic growth and excellence in patient care. Join us as we dive into expert advice and success stories from healthcare leaders around the world. In this episode, we're joined by Dr. Marc, the esteemed founder of Aesthetic Specialty Center and a renowned expert in facial plastic and reconstructive surgery. Dr. Yune is about as qualified as they come. He is a triple board certified in facial plastic surgery. I'm going to butcher the pronunciation here, but
head and neck surgery is just
head and neck surgery and cosmetic surgery. He's completed a prestigious fellowship in facial plastic and reconstructive surgery with an emphasis on cosmetic facial surgery, and he is well regarded for his development of innovative techniques such as the DART procedure. With a career spanning over 2 decades, Dr. Yune has made significant contributions to the field, including authoring techniques on revision rhinoplasty and breast augmentation, and serving as a clinical consultant and trainer for major industry leaders. His practice, Aesthetic Specialty Center, is dedicated to excellence in facial, plastic, and cosmetic surgery. His vision is to advance the field of aesthetic medicine through continued innovation, patient care, and education, while also doing everyone a favor and sharing his extensive knowledge and experience with the medical community. So that being said, Marc, it's a pleasure to have you here.
Well, it's an honor, and thank you for the detailed intro. Hopefully we didn't lose anybody through that.
Hopefully really not. Well, listen, if it gives an insight to the amount of value that you can provide, I'm sure people will be nicely tuned in. But
happy to be here and honored to be here.
With that being said, I suppose let's just dive right into it. Your journey into the field. We talked about this in a previous conversation that we had, Marc. But could you walk me through that at a high level? I know you come from a long lineage, as you said, of good stock in the medical space. What's that roadmap look like, and how did you end up where you are today?
Well, it was really multifactorial, but probably the biggest factor is growing up in a family that has a long history of medicine. My grandfather was one of the first Western-trained surgeons in Korea. British med school came in, and he was given the opportunity to have some real high-level training. And then he sort of, the legacy from that passed on to my father, who was he also was a triple board certified surgeon and radiologist and neuroradiologist. So having grown up with him as my mentor, really, it gave me good guidance into being able to explore all the medical field. So I was blessed to have that in my family.
Obviously, having such a powerful mentor such as your father, must have been incredibly helpful. And how did having such a role model, number one, influence your decision, but more so, what key lessons did you learn from your father that have helped you shape the way you practice today?
Yeah, well, thank you for that question, because I could actually spend the whole hour talking about my father. He's really pretty remarkable as a human being. It's hard to even express into words the impact he had on me, but he was just, first of all, just a great person. He was a firm believer in God. He instilled that in me. And he was really just an excellent pursuer of knowledge, if you will. And then also he was an excellent caregiver to patients. So he was actually one of the first interventional radiologists, pretty much self-taught. And he started out his career as a general surgeon, then was brought to America on a Presbyterian mission to learn radiology at Vanderbilt, which then he went back to Korea to help start modern radiology. And then once he paid his dues, he came back to the States, brought us all here. I immigrated when I was 11 months old. And so I grew up in Nashville, Tennessee, as a Korean Southern boy. He really helped build the interventional radiology practice. And then we moved up to Indiana. And it was really through that I had a love for head and neck anatomy. And he introduced me to the specialty of head and neck surgery, which is then how I segued into facial plastic surgery. because I always knew I wanted to be a surgeon. I think he wanted me to be a radiologist, and he was a procedural radiologist, but I didn't really want to sit in a dark room that was air conditioned looking at x-rays all day. That was kind of boring for me. So I wanted to do something that was beyond just, mental. I wanted to implement some physical skills, and surgery was my calling. And then you find facial plastic surgery, which was just wonderful because it's an art form. It's really somewhere where you can be creative, and it's not rote, same surgery over and over again. Every surgery is different. So I just developed a passion for the artistry of it.
That's great. And don't get me wrong, we'll definitely be diving into, your passion, because it really shines through when it comes to cosmetic facial, facial surgery. But before we dive into that, you've obviously, I said you're about as qualified a person as I've ever talked to on this topic. And I can imagine, you definitely picked up a thing or two, for example, during your fellowship. Were there any pivotal experiences during your fellowship that shaped the way, shaped your approach to cosmetic surgery? And is there any experience during your education in South California that might have contributed to your unique perspective?
Yeah, I was very fortunate to land a facial plastic surgery fellowship, which was in 96 and 97. I stayed on another year as an employee with my mentor. And I chose this particular fellowship because it was heavy into facial cosmetic surgery, especially rhinoplasty, which was a passion of mine, because I always feel like rhinoplasty is one of the more difficult surgeries. So my journey, I launched to try and take on the most difficult thing. And through my experience, I really developed a passion for corrective surgery, because what I noticed during our fellowship, since my mentor had a good reputation, was we were seeing a lot of complications coming in the practice from other surgeons. And I really saw that predominantly in rhinoplasty. So that's where I developed a passion to develop the DART, the D-A-R-T procedure that you were mentioning. With the assistance of my mentor, we were able to develop a technique that fixed over-resected noses. Think about the shortened nose or the pinched tip, or the worse yet, the nose that resulted in a compromised airway. So this technique was, in my opinion, revolutionizing how revision rhinoplasty was performed. Using structural grafting, we can build the projection of the nose back up. We can rotate it in a controlled fashion. We can create projection. And with these three struts, like a tripod, it simultaneously opens the airway. So that was kind of a first, because there have been airway procedures, there have been cosmetic procedures, but not really blending the two is what the DART is all about. It's control. And then what is really cool about it is you take a patient who had really not such a positive experience, and you can make them happy again. So that's the reward, aside from just the techniques and the creativity. The ultimate goal is to have a happy patient. That's what happy medicine is all about.
I love that. And I can't but follow on that statement. As you said, happy medicine. I love that term so much. Would you mind telling me a bit about, the concept of happy medicine? Because it really shines through, from chatting to you, the way you run your practice, your driving force behind it, so your faith, everything. I love the consistency here. Would you mind telling me a bit about what you deem as happy medicine?
I would love to. I really feel like I have a passion for serving my fellow man. I mean, ultimately, in our short life on earth, I think it's important for us to look after our fellow men and women and love them. And that's what I was raised to do, being in a very faithful family. So this is the greatest tool for me to be able to do that, to accomplish happiness. Because if you really put your effort into focusing on patients with realistic expectations and delivering them a solid result and give them a great experience, it's multifactorial too. It's very experiential, what we try to do here at ASC. I always tell my staff, I want you to treat the patients like you'd want to be treated. I say, consider yourself like the concierge at the Ritz-Carlton. We want to roll out the red carpet because our patients, especially the cosmetic patients, they don't need to be here. They're not ill. So it's a totally different kind of medicine. It's a different paradigm where you're actually taking a healthy person and you need to keep them healthy. and you need to give them results that make them happy. So we really enjoy it because I don't have to deal with illness and sickness, which is great that we have doctors who can do that. We're really working on the psyche of the patient and giving them confidence and self-esteem. So we strive for 5-star reviews and hugs and cookies at the end of the day. That's what we get to enjoy. We have a really great positive environment. Hiring the right kind of people really matters. And that's what I feel like we've been having good success with. I'm sorry, I forgot the second part of your prior question. So not to confuse the audience, I continued my in Southern California because my patients, after having done successful facial surgery, asked me to do their body work. So I actually joined a group in Southern California, traveling and learning from very friendly surgeons how to do breast augmentation and some tumescent liposuction. So I do a limited practice. It's very focused on facial cosmetic and just those 2 body surgeries. And it was really a great experience. That helped me develop the ICE procedure, which is revision breast augmentation too. So not to get too tangential, but I just wanted to address that. Realized I forgot that question.
No, I love everything here. Actually, out of genuine curiosity, I'd like to hear more about that ICE procedure in a minute. But I can't help but, it's funny, I think I literally have a copy. Where is it now? Oh, this is completely off script. I have a copy of because you did talk about the experience in the psyche. I have a copy of there's a book, Psycho-Cybernetics, and it was written by a plastic surgeon originally. And what I love about the synergies between your sort of, I suppose, outlook in life in general and the way you're viewing the business is, in the book, he talked about how ultimately you can make all the physical changes to somebody that you want, but unless they start identifying themselves as that new person, and I'm sure you see it all the time, they may not accept or embrace that new sort of beautiful version of themselves and love themselves with I suppose, what they deserve. So I love the fact that you're addressing the psyche in addition to the physical. And I don't know, I just want to put that out there because I think it's very powerful.
It's good to emphasize that because it's critical. In order to have a happy practice, you have to choose your patients wisely too. This is all elective, right? So we're not here to just make money. We're here to create happiness, and that's your ultimate goal. And then you don't have to worry about the money, because if you're focusing on the right thing, a patient with the right attitude, with realistic expectations, and you stay in your lane and do what you're good at, and it's a win-win every time. Yeah. So I really like to interview my patients in great detail. I get to know them, in our initial consultation. It's not cursory. It's very detailed because I'm not just trying to figure out what they want aesthetically. I'm trying to figure out what the goals are emotionally too,
I love that. I suppose the combination of this plus the DART technique and a lot of, I suppose, new outlooks, both in running a practice and the actual techniques themselves. Did you feel when you were starting off that there was any sort of pushback on the way you want to run a practice? And I suppose, were there any initial, difficult lessons that you had to learn when getting up and running, doing your own thing?
Well, I'll tell you, back when I started my practice, I turned down a wonderful job opportunity, being able to be the facial plastic surgery director at my old university where I studied med school all the way through head and neck surgery residency. So I turned that down because I really felt like I would be more satisfied in a clinical setting, taking care of patients one-on-one. I like teaching, but I like teaching those that really want to be there, not just necessarily being assigned an academic role. So I was considered a little nuts when I started out my practice because I took out a bank loan, hung a shingle, and opened my practice with 0 patients. And so it was challenging because, it's a make it or break it kind of situation. You have to produce some good work to build a practice. You talk about direct referral and networking and just how we built this from the ground up. It was a hard journey, but it was really enjoyable because it was a challenge that I was set out for. So I think there's 37 fellowships in the country in facial plastics. I think I was one of the only ones that came out of that graduating class starting my own practice, which that's why I say all my colleagues thought I was nuts. But it's paid off because I've been able to kind of control the trajectory of the practice, the philosophy, our culture. And it's just been very satisfying. I feel very happy with where we are.
Love that. And when starting off, there's a framework that I often refer to when talking to guests it's from the book, The E-Myth Revisited. And the idea being is when you start a business, you're simultaneously the technician, in this case, the physician or practitioner, the entrepreneur, the manager. And a lot of times when people are starting something new, they don't realize the other complementary skill sets that they unknowingly will have to develop. Were there any skills that jumped out at you when starting off that I suppose you perhaps struggled with initially and then can look at yourself now and say, I've mastered that? Because I know you have a big team and you obviously developed a lot of complementary skills along the way.
It's funny because in medical school and medical training in general, they do not teach you much at all about business. Doctors come out of their training with technical skills, with a lot of knowledge, but they really don't know how to run a business unless you have it inherently in yourself. If you have an entrepreneurial spirit, it's not so intimidating. That's why I felt like I always was involved with businesses even before going into medicine and felt like I could take on the challenge. But you have to be fluid. You fly by the seat of your pants. And I'm kind of a self-taught businessman. I think I do things pretty well, but I think you always have to strive on doing things better. One thing I always try to ask myself is, how can I do this better? I don't think you should ever rest on your laurels. But everything from hiring staff to how do you handle a consult? How do you do pictures? How do you do pre and post ops? It's way beyond just surgical technique. You have to think about the whole package all the time. So you have to have a very organized approach. You have to be surrounded by people who are equally organized and passionate about being very thorough, because this is not a profession for the faint at heart. You have to be very compulsive in this industry because it's, like I said earlier, it's a different paradigm. We have a healthy patient. We actually have the opportunity to take a healthy patient and make them sick, which we don't want to do, right? Do no harm. That's the Hippocratic Oath. So you have to almost be a little more compulsive than standard or traditional medicines that listener might think, because we have an elective person who's healthy. So it's a different kind of level of compulsion. So sorry for the long answer, but that's kind of where my general thoughts are about building and starting a practice. That's a philosophy that's helped me.
It's certainly an interesting philosophy and definitely an interesting framework that I can say in my end is something that I wouldn't have considered. The fact that, as you said, they're coming in, they're physically, they're fine. Right. So you need to do a great job for it to, effectively, be worth it. And it's definitely interesting, I suppose, paradigm shift on that. That, I suppose, combined with the fact that you're, as I said, pioneering techniques such as the DART technique and all that. When starting, do you feel there's an element of perhaps imposter syndrome, or do you have mentors that helped you along the way, or what does that look like? Did the imposter syndrome ever leave, or was there a moment where you thought, "Wow, I know my stuff"?
Well, fortunate thing about fellowships, which frankly I think should be mandated, because there is very little cosmetic training in traditional residencies. It's not uncommon for a reconstructive plastic surgeon to graduate with zero cosmetic experience. People think of plastic surgery as an all-encompassing field, but there's so many subspecialties within it. Let's take mine, for instance. I focus on really just a handful of surgeries. My practice is facelift, eyelids, rhinoplasty, chin implant, otoplasty, and then breast aug and a little bit of lipo. So I stay in a real narrow lane because it keeps things predictable and safe and repeatable. And then there are those who specialize in reconstructive surgery, breast cancer reconstruction, for instance, motor vehicle accidents. There's those that specialize in pediatric craniofacial surgery. So the spectrum is very broad. But I guess what I'm getting at is really honing in and staying within your expertise is critical to success. And that came from Dad too. He always explained to me that you don't stop learning ever in medicine. When you stop pursuing knowledge, you need to hang it up because you're not serving your patients well. So I think once I got through my fellowship, it gave me the opportunity to create the DART technique, and then the ice procedure, because it was a great stepping stone. So after 2 years of being with my mentor, I had accumulated 1,500 surgeries, all cosmetic. And then through my travels throughout Southern California, I accumulated another hundreds of surgeries in breast and body work. So it wasn't rudimentary training at all. I mean, the reason I say it should be mandated because there's not enough experience with cosmetic surgery is it's definitely a skill level that you don't learn in regular residencies. To protect people from getting botched jobs, what helped me drive forward and do the DART procedure is making sure that surgeons are well trained before they're given privileges and rights to do what they do. I think it should be experience-based, not just a piece of paper and a board certification. That doesn't tell you too much. That just tells you passed a test and did a residency.
Yeah. It reminds me, there's that saying, confidence doesn't come from shouting affirmations in the mirror, or in this case, having a piece of paper. It comes from having a stack of undeniable evidence that you can do what you're saying you're going to do.
100%. I always tell patients, how do you find a plastic surgeon? I think largely because it is artistic and it is an experience. You really need to rely on pictures and reviews, not fancy words and marketing in terms of embellishing what you do. It really comes down to evidence-based, like results, before and after pictures and reviews. So that's what we're always trying to strive for, is develop great results and have happy patients who are willing to give us 5-star reviews.
Yeah. Look after the patients and the revenue will look after itself.
That's right.
I can't help but ask, so the ice procedure, what does that look like? I suppose what sets that apart?
Yeah. So
as a specific technique.
Okay, yeah. The ice procedure is the internal capsule elevation. That's just a little mnemonic I came up with describing a sutureless repositioning of a malpositioned breast implant. So sometimes women will come in where the implant is too low or too lateral, and so it doesn't look natural. So, I think the thing we really have to emphasize in cosmetic surgery is natural appearances. People don't want to look like they've had plastic surgery. They just want a result. So if you're good at what you do, nobody even knows you did anything to them because they look like they could have been born with this anatomy. The ice procedure was, in my mind, a very simple technique, but one that I basically developed off simple observation. Okay, so I had a patient who had a saline implant deflation, and she had it delayed before she could come see me. So when I was opening the pocket back up to replace an implant, I noticed that the patient's body started healing to itself, which is what happens normally physiologically. When the normal capsule that forms around the implant starts sealing to itself, the light bulb went off because traditionally the implant that's too low or lateral was treated by stitching the capsule to the ribs and the sternum and trying to make the implant go up. Well, what I realized I could do was take advantage of the natural physiology of healing and do a little electrical fractionated cautery technique on the inside of the capsule. Simply put them in a sports bra with a light band on top. I call it the trap wrap, and the body makes the stitches for itself. So when you talk to original breast surgeons, they don't like the suture capsulorrhaphy because it's fraught with complications, because each stitch site can cause a dimple or misshapen anatomy where you really want to see a nice curvilinear base of the implant. So it took one of the most frustrating surgeries and turned it into one of the most simple. I published that in 2016. I developed in 2011, but I had to find a group of women who were willing to let me try some experimental surgery on them. So it took a minute to acquire that. Man. Yeah, I'm really happy and proud to present that to my colleagues because it takes the headache out of suture capsulorrhaphy. We made it sutureless.
I love that. I remember to rewind, just it reminds me back when I was doing my bachelor's degree in biomedical engineering. I remember my final project was basically on the use of biodegradable polymers for stents, basically, because it was its own way of sort of addressing that issue of, ultimately sometimes the body just doesn't respond the way you want it to a foreign body. So I love the fact that you managed to find a solution that was leveraging, as you said, the body's own physiology without having to do the suturing and potentially just add more moving parts than are required. So I think it's an extremely neat solution. I love that.
I loved it too. I really felt strongly it would work. And so when we did our first case, we had tremendous success, and she actually referred me the next patient. These were actually young ladies who had the need for revision rhinoplasty, who had misplaced breast implants. So all three of my first cases was that scenario. And that way they were willing to let me try it. And we had great success with the first three, and then we were able to publish it. But it took me 5 years. I think, sometimes your best inventions, or whatever you want to call it, are right under your nose if you just pay attention and really listen to your patients and focus on what's going on right in front of you, really.
I love that. Like we said, take care of the patients and looks after itself. And then you can help more people, as you said, which is obviously the end goal. Again, building on that whole point of focusing on, I suppose, community and relationships, because it's my belief that everything in life boils down to the quality of your relationships, both with yourself or with others. Talking to you, it's very, very clear that you view the ASC team as a family. You've mentioned you've over 40 people working or as part of that family. How do you approach managing team culture, and are there any strategies that you like to use to build and maintain it?
Well, I've been really fortunate to surround myself with some wonderful people. I try to find like-minded people as my core group. My manager, for instance, she's very similar in her philosophy to how we run the business, Ashley. And my wife, who also works for me, we are a family. In fact, our group me thread is named the ASC fam. And I think, work-life balance is so important. I tell my staff, your family is more important than your job. The job's a means to take care of them, but I want good work-life balance for everybody. So what's really cool about our culture is we have 40, sometimes 40 plus staff, all women. I'm the only physician. I've got 10 other providers and nurse practitioners, PAs, RNs, estheticians, and then we have a great support staff. But what's really cool about this group is they love each other. They're friends. They hang out together. They go out to eat together. They have gatherings. We just had a fun birthday celebration for one of my lake staff. We've got an office at Lake Oconee, and we had a really great gathering. That to me is what this practice is largely about, is creating a culture of positivity, not just excellent patient care, but good camaraderie. And even though we have 10 providers, a lot of them doing the same things, we don't create a competitive environment because we really nurture them through, the positive culture and education, constantly teaching. That's just part of what we do. So we've got a group of smart, professional, awesome people. I couldn't be more blessed.
And do you feel that there are parallels with the way you like to deal with the patients themselves and the team members? A mental model that I often think of is ultimately principles in relationships are universal, be it, business, platonic, romantic, familial. It's quite universal. It's, respect, communication, trust, and good intentions, I suppose. Are there any parallels with how you like to treat your patients, in terms of making sure they feel informed and comfortable? And is there a role that patient education plays in your practice?
Yeah, education is paramount at ASC. So when I do a consult, for instance, I'm oftentimes spending over an hour talking about one procedure where we'll take, medical photography, we'll do computerized imaging or video imaging. It's not just about the procedure. We want to micromanage their recovery. So we're seeing the patients frequently, sometimes at 1 day, 1 week, 2 weeks, 6 weeks, 3 months. Being very compulsive about how you care for a patient and making sure they're educated all the way throughout their journey, because it can be very intimidating to take on elective surgery, obviously. So I try to put myself in the patient's shoes, to use a cliche, and I tell my staff, let's do the same thing all the time. That's why I keep referring to our practice is more of like a concierge type service where you're really rolling out the red carpet, making the patient feel well cared for. And I love when I hear patients telling me I did a consult elsewhere and nobody was this detailed. So it's very rewarding to make a patient feel well cared for. Again, because it's elective. So
Yeah.
That's what we really strive for.
And again, I think, especially with your credentials, it'd be, and the training that you put everybody through, concierge is the only way to play it. I think it does beg the question, obviously, with your marketing, does that positioning affect the way you do your marketing? Because I personally have some thoughts on this, but I'd love to hear how that, how you've managed to get new clients without, as you said, coming across salesy and things like that.
Yeah, I think a solid practice, one that's fairly recession proof, is one that's built off a direct referral. So how I started my practice was I operated on one patient in hopes that they would be happy and refer the next patient. It was a different era when I started nearly 30 years ago where we didn't really advertise. In fact, within our inner circle of fellowship trained facial plastic surgeons, it was kind of frowned upon to advertise because here's the thing. If you're a good doer, you don't really need to advertise yourself. Your advertisement is the patient who speaks highly about their experience with you. So direct referral really built this practice. And still to this day, probably over 80 to 90% of my patients come from another patient. Not because I'm Insta famous or, dancing on TikTok. It's really just about happy patients. So it's been a great journey. We don't do discounts. We stay normally priced, and really, if you can go out and make your patients happy, that has been the key to my success. Now, times have changed, and I realize a lot of people rely on the internet and social media. So we do have a footprint in all of those, but the gist of my practice was ground up, organic, meet and greets, and direct referral.
No, it's great. I think the only thing I would add on there, because as you said, times do change. Number one, I love, and again, you gave a funny anecdote about a bit of pushback from team members when you explained that offline marketing does work. As you said, shaking hands, making those connections. I think that's incredibly powerful, and I'd love to hear that story about how you got started, because remember we talked about it before. But you can share that. I'll share my thoughts on the digital marketing equivalent of that, but I'd love to hear that story for anybody listening.
Well, because we didn't have social media and internet was in its infancy, you had to actually go out and shake some hands. You had to let people know you existed. So I would talk to anybody that would speak with me, and I would give seminars. I give PowerPoint presentations. Again, in my fellowship, I had accumulated so many cases, so I came out with experience. I went out and met local businesses, other physicians, and just went out and tried to ingratiate myself with the community. It's a different culture right now, right? Because everybody just wants to text you. They don't even want to have a phone call. But back in my day, if you didn't shake somebody's hand and go meet them face to face, it really didn't build a relationship. And that hasn't gone away. Even in the era of digital marketing and social media, I still value and I still refer to the physicians who bother to come into my office and meet me and tell me about themselves. So when you do it with an educational approach, it's not salesy at all. You're really just trying to teach people how we take good care of patients, and we're a safe person to refer to. And so organic growth of a practice, it still works. I have a hard time getting some of my younger staff to buy into that because, again, they just want to get on Instagram or TikTok and promote themselves that way. But that industry, it's helpful if you get Insta famous, but it's also kind of a dime a dozen. When I was talking about earlier where we kind of frowned upon marketing in my infancy, just consider this scenario. If nobody was allowed to advertise, the only people that would survive in my industry are good doers, because you would produce good work. Because if you didn't produce good work, nobody's going to refer to you. So again, I'm not trying to be a dinosaur here and say that's all you should do, because I totally understand the benefits of digital marketing and what have you. But there's something really special about a person who'll come up and shake your hand and meet you, take time out of their day. It's still worth its weight in gold.
Yeah, no, I do. Again, being someone who runs a digital marketing agency, I completely do agree with that. I think there are many different types of practices in clinics, and I think a strategy needs to be adjusted based on the goals and even the personality of the business owner. And I suppose for anybody listening, a bit of a crash course on different strategies that they can implement on the digital side of things is, broadly speaking, two forms of advertising. That's search-based advertising and sort of, I suppose, interrupting advertising. So what you're talking about here is, again, not wanting to come across as salesy, having ads pop up on Instagram or Facebook. Completely understand it. I would implore anybody here that perhaps doesn't want to come across as salesy, and it's very important for them to retain that concierge experience, that high ticket, high value experience, is, the digital equivalent of a referral, as you mentioned, is reviews. So ultimately, we want it to be the case when people look up best plastic surgeon, enter city here, or rhinoplasty, surgery, etc. Make sure you're coming up at the top of Google. At the end of the day, as you said, especially in this industry, reviews as well as in-person relationships are worth their weight in gold. So anybody listening, SEO, that's organic search engine optimization, or Google ads are a great way of putting yourself out there, not coming across salesy, and letting the results speak for themselves. Because at the end of the day, nobody's ever gone on Amazon and bought the pair of shoes with the least amount of reviews. If you've got a good strategy, get reviews in Google, it's a great way of leveraging, as you said, the excellent results that you're getting.
I couldn't agree with you more. And I love what you're doing, because let's face it, I mean, the internet is here to stay. We've graduated into social media, now AI. And if you don't stay current with technology, you're going to be left behind. But now there's so much information out there. We do leverage social media, our website, SEO, what have you, and really just trying to focus on an educational approach. Because if you're an educator, you're not pitching something, you're not giving a discount for something to attract a patient. You're attracting a patient because you know what you're doing and you're willing to share information and make sure they have a very thorough experience. So, but digital marketing is here to stay, and I love it because it's really fascinating to be in this era where technology has just taken off. So I'm excited to talk to you more about that.
Definitely. Yeah. Happy to help any way I can. On the topic, as you said, education, feedback, relationships, I remember something I journaled ages ago was, life is a dialogue, not a monologue. So make sure to give back. And with that being said, I suppose the point is, listening is at least as important as educating. We have 2 ears and 1 mouth for a reason. Are there any strategies that you use to incorporate patient feedback into your practice, and how has that helped you to improve your services?
Yeah, I think you brought up a very important point. With the patient visit, you have to be a great listener, because if you don't address what the patient's chief complaint is, as how we say it in medicine, then you're missing the whole point. So I'm not in this business to tell a patient they need surgery. They don't need surgery. They're here for their reasons. And some of the mistakes I hear others make is that, they suggested a surgery the patient was even thinking about, which can be quite offensive, right? If you come in talking to you about their nose and you tell them they need a facelift, that's not really very smart, but that happens, unfortunately, in my industry quite a bit. That's where salesy gets to the point of being cheesy. So I think really listening, taking on the patient's concerns, and then designing your treatment plan around that, that's really the secret sauce to how do you come up with a happy patient.
And do you have I suppose, a system for getting feedback from people so that you can you improve your experience, or does it all just boil down to whoever's running the procedure and just having that conversation? Is it organic, or is it systemized, or how does that look?
We do ask for reviews, and we could help enable them to make us reviews even when they're in the clinic. And frankly, just talking to your patients and asking, how could we do better? Showing that you care. So just getting organic feedback on it on the daily with every visit. I think if you take enough time to see your patients, even after you've done their surgery, and really tend to their healing, you get a lot of feedback. Patients will tell you have to be open to listen to them. We get feedback with every visit, and you got to take that in and you got to relish in it and learn from it.
Yeah, I said ego's the enemy. If you think you know better than the patient, you're probably wrong. You can't tell them that they like something that they don't. So I think it's great. I love the humility, the approach that you're taking to this, and it's a case of iterating with everyone. But you did touch on something there. Obviously, patients will give feedback, but as with anything, especially a service-based business, managing patient expectations is obviously crucial. And a lot of the work you do isn't simple. It's very complex. How do you go about ensuring patients have realistic expectations? And how do you handle maybe, cases? How do you handle cases where expectations may not align with achievable results?
Yeah, so great question. I think one of the most powerful tools I use in my practice is computer imaging. I use Mirror, and what it allows me to do is do a computer mock-up of what I feel like I can deliver. In other words, I don't do a computer imaging of a facelift and make them look like they're 16. That's not realistic. We might make them look 10 to 15 years younger. So one of the hardest things I had to learn was how to use the software program. Frankly, it was a little harder than some of the surgeries I do. But incorporating it into my practice where I could really show a patient, I call them 90%ers. I tell my patients what I just mocked up here is not exact. No imaging is exact. It's a computer. But this is what I know I can deliver because I do these same procedures over and over again. So it's quite predictable. Then the patient goes out with a picture in hand. They can share with their spouse, their family, or loved one, and they have something, tangible that they can look at. So computer imaging is a huge part of what I do. Photography is more important than my written notes. Really, that's our documentation, is really what does it look like? The patient that has unrealistic expectations, and this is why it's so important to have a long consultation, really get to know somebody, is sometimes not a good person to operate on. If you don't align well with the patient's goals, it's better to elect not to do surgery, right? So I think getting to know your patients well, giving them realistic expectations with computer imaging, and also knowing when to say no. And it's not easy, but sometimes it's better to do that than think that you can fix the world by just doing cosmetic surgery. That's not how it goes. You got to pick your patients wisely.
I love that. There's nothing that I completely agree with everything you're saying. Fast forwarding, I suppose, to the future. You've obviously got plenty of experience. You're staying up to speed with everything. I love the point that you're making about computer imaging. I think that's incredibly powerful, and I suppose simultaneously helps put people at ease, but also, as you said, addresses that realistic expectations component. Are there certain trends what trends do you see in aesthetic medicine that you believe clinic owners should be aware of? How do you personally see the field evolving in the next 5 to 10 years?
A lot of the surgical techniques are fairly consistent throughout the 3 decades I've been doing this. Still, I think the best techniques for facelifting is the deep plane facelift, and virgin rhinoplasty is the open rhinoplasty. So, really, I think what's happening now is the demand is more for non-surgical devices and treatments that can give patients results with less downtime. That's kind of what human nature drives us to do. We don't necessarily all want facelifts and eyelid surgery. So you have to stay current with the technology. I have a laser rep or a device rep calling on me almost every week, trying to show me new technology. So you have to kind of sift through that because there's a lot of great stuff and there's a lot that's not so great. We have approximately 12 or more non-surgical options in the office for skin tightening, for fat reduction, for muscle toning. et cetera, color correction, veins. So I really paid attention to the advancement in non-surgical technology. And one of the coolest things on the forefront right now is stem cell technology and growth factor injectables that can really rejuvenate the face, for instance, without having to even go under the knife, for lack of a better phrase. So yeah, I think non-surgical is definitely the trend. I don't think they're going to replace me with a robot yet, but
I think you're safe enough.
Yeah, with AI and robotic surgery technology, who knows? But I think you got to stay really diversified. So we're seeing everything from the facelift patient to the cool sculpting patient to the Botox patient. You have to offer a pretty wide menu of services.
Yeah.
Current.
No, I mean, I agree so much with that. You know, my personal journey is I used to specialize in SEO, and I remember someone saying the sentence, focus on the who, not the how. And I think that's so universally applicable to especially any service-based business. You know, when all you have is a hammer, everything looks like a nail. And ultimately, as you said, you know, sometimes Botox may not be the best fit. Maybe there may be a non-surgical, solution that can potentially, you know, be it peptides, be it what have you, that can regenerate that collagen and so on. What are some examples of non-surgical, procedures that you're offering these days?
So our most popular are the injectables, Botox and fillers, neurotoxins and fillers. And then we offer one of our most popular devices is cool sculpting, which is freezing the fat, non-surgically reducing subcutaneous fat. And then we use ultrasound in the form of ultherapy to do non-surgical skin tightening. By heating the skin and the soft tissues to a critical temperature, you actually get contracture, or what I call shrink wrapping of the face. Microneedling with radiofrequency and fractionated CO2, we use a device called Secret Pro. So this helps, again, heat the skin, adding collagen and elastin to the skin, tightening fine lines. So between Secret Pro and ultherapy, it's kind of like a sandwich effect where one's heating the surface of the skin, one's below it. And that's probably your best non-surgical facelift.
Yes.
And then we have XLV laser. It's to treat vascular lesions. It has 50 different indications, but that's what we use it predominantly for. Then we have hydrofacial, diamond glow, which are medical grade facials. Microderm kind of fell by the wayside because people don't want to walk out with a sandy face. And then we do BBL as broadband light as a newer form of IPL where you can really specify more browns or reds. It's color correction. Then we have laser hair removal. We have the fastest, least painful laser hair removal device. We have cold diode to help stimulate hair growth. We have Auragraft, which is single follicular unit hair transplant. We have Thermi, which is a radiofrequency energy-based device to help tighten skin and actually do female rejuvenation. And then we have Cleavana, which is a sound wave technology, which increases orgasmic potential in women, 83%, pretty powerful, new technology. So, cool. I'm going to put out my whole list with you if you don't mind. Cool tone is magnetic muscle stimulation. That's how you can actually cause contracture of certain anatomic areas like the abdomen, thighs, buttocks, and maybe give you the equivalent of 1,000 sit-ups versus what you can humanly do. Very helpful for the athlete, really. That's another segue we're going to get into, is helping promote that to the professional athletes. And then, we have a wellness team too. I brought this on fairly recently, and I actually did it because I turned away a lot of lipo patients because they were frankly obese. And I think that's a disservice to a lipo patient. So I would request that they would lose weight, get as fit as they could. And of course, most of the times they didn't do that. They'd find a surgeon that would do lipo on them when they're obese. Yeah. So I brought in wellness for the help of weight loss through semaglutides. And my wellness provider is actually expert in bioidentical hormone replacement therapy and supplementation. So we didn't really learn this in medicine traditionally. Preventative healthcare is really what we should be teaching and passing on to our younger generations. I make people look good, but I want them to feel good. So wellness has been a huge component to what we do. That's one of the newest things that's happening in medicine is preventative medicine, not wait until you get sick and giving you what we call a pill for your ill. We're actually helping you prevent illness by doing supplementation and bioidentical hormones, for instance. So it's really catching on. It's one of the fastest growing specialties in medicine. I might be missing a few things, but that's pretty.
Is that all? Yeah, I was going to say, I was going to start counting on my hands, but I don't have enough hands.
Right.
No, I think it's great. I love the fact that you're gearing towards a preventative side of things, on sort of a meta level, with the fact that you like to address the psyche as well as the physicality. I love the fact that, from a yin and yang standpoint, you're addressing the after the fact and before the fact. So I think it's a really great holistic approach to improving the quality of these people's lives that you have. I do have two questions, and I want to be respectful of your time, but in your experience, obviously I'm sure you've seen it all, and there's plenty more to see. It's exciting. Can you share some of the most memorable moments or cases from your career that have had a lasting impact on you, Marc?
Ooh, that's a tough one because I have so many great experiences. When I have a patient coming in and being happy about the results, that really makes my day. But I can remember a case I did very early on. It was actually during my fellowship where a very shy, it's actually just a 15-year-old young lady, was brought in with her parents. And she could barely speak to me, but her parents explained to me that she was getting bullied at school. And it was just largely because of her appearance. She had a very prominent nose and a real small chin. So finding out that she was mature enough to take this on and having, the full blessing of her parents, I took it on as a challenge because I really felt like we could give this girl some self-esteem. So we did rhinoplasty chin implant on her. And by the time she graduated, her senior send-off was that she was the prettiest girl in her high school class. And then she just flourished after that. She became, leader, president of her sorority. She has a wonderful job in pharmaceutical sales. She carried herself so proudly. I actually hired her as my nanny for a period of time too. It was really neat to see that journey of shy, bullied school kid to confident, robust life. And just, that's the key to what I'm talking about with the psychology and how we can help people with their self-esteem. That was one really memorable case. And then I used to do a lot of charity work with face-to-face victims of domestic violence and victims of foreign war. So we've done some pieces in the distant past with the Discovery Health Channel and various TV networks where we would take a victim of domestic violence, for instance, and offer them gratis surgery. We would make sure they were away from their abuser for a year and then give them a transformation. And those were some really rewarding cases. We did a bunch of those, and I really enjoyed that, helping them, entice them to get out of a bad situation, but also giving them reward of, helping them with their appearance and their confidence. So those are just to name a couple.
Yeah, fresh start. I love that. Last question before we finish things up. We've talked about this before in a previous conversation, Marc, about, I suppose, the alignment in the work that you do and your purpose in life in general. You've mentioned the importance of a balanced purpose in life when it comes to striving for business and personal success. Could you elaborate a bit on this philosophy and how it's influenced both your personal and professional life, please?
I really attribute all my success and fortune to God. I think that the key for me to have this happy, joyful, peaceful life is I center my whole life around Him. And if I can implement that into my practice philosophy of loving your fellow human being, how we approach their healthcare, how we approach everything, that's really the legacy that I want to leave behind. It's really not that hard to love your fellow man. It makes life so much better, so I hope I can pass that forward to my children and my younger generations where we really keep our priorities straight. And then it's so simple. You don't have to think too hard when you have the right priorities. So you just can't get focused on self. You can't get focused on minutia. You have to keep an eye on the prize. That's God.
Love that. There's no better way to finish this up. I just want to thank you again for your time. I've really enjoyed this conversation, and I can honestly say I'm personally going to be listening to this several times because you dropped a lot of gems. And look forward to hopefully doing this again at some point. With that being said, where can people find you, Marc? Online, website, LinkedIn, etc.
Website is okay. Thank you. Website is www.asc-psd. So that stands for Aesthetic Specialty Center Plastic Surgery Dermatology. And then our phone number is 770-393-9000. We have an office in Roswell and Greensboro, Georgia. And so we'd love to hear from you. But at least I hope we gave some good educational content here. And you're awesome. You're so easy to speak with. So I really appreciate your time. It's very generous of you to host me.
I appreciate your appreciation. As I said, I look forward to doing it again.
Sounds great.
Keep it that.